To Healthy Habits for a Healthy Smile. This presentation is brought to you by All Smiles Community Oral Health, and this specific presentation is made for family advocates. And I will be running the presentation. My name is Jordan Burklund. I use she, her pronouns. I am an expanded practice dental hygienist as well as the community education specialist for All Smiles Community Oral Health. I have made this entire presentation in mind with the family advocates that we work with in the various Head Start and preschool programs. But if some of this information does not pertain to you, feel free to skip ahead to the relevant information. For today, for this presentation, I'm going to cover quite a few things. First, we're going to talk about dental basics and identifying common dental issues that we tend to see in the classroom. And then I'm going to explain what we do when we find those issues, how we refer those patients to make sure those patients get seen and the problems are dealt with. Then I'm going to provide you some basic information that you can use to educate parents and families in just basic preventive and restorative dental care. A lot of families have a lot of questions that sometimes get fielded to the family advocates. So this is kind of made to empower you with some of that information that you can give to the families. And then I'm going to explain our workflow, the All Smiles Head Start Pre-K workflow from start to finish, what that looks like. And then lastly, I'm going to provide a lot of resources and answer a lot of frequently asked questions that we get from either family advocates, staff, or from the parents themselves. A lot of this is just trying to give you a bunch of information to help empower you to um, work with the families and give them the information that they need to get the things done that they need done to ensure that their kids have the healthiest teeth, the healthiest mouth that they can have. So firstly, for dental basics, as far as answering questions, a lot of people have questions about tooth growth, tooth problems, and questions about treatment and how to prevent issues from coming up. So we're going to touch base on all of those things. First thing I want to answer is the big question we get a lot of times, which is why are baby teeth important? Baby teeth, a lot of people kind of question why we need to take care of baby teeth or get treatment done if, say, a baby tooth has a cavity, because it's going to fall out eventually and you're going to grow permanent teeth. So why are baby teeth important to keep? Well, there's several reasons why. Firstly, eating. If kids are missing teeth or are in any pain because of tooth issues, it can prevent them from eating a lot of foods, maybe favoring a certain side of the mouth, maybe being unable to eat certain foods entirely. So it can affect their nutrition. It also can affect their speech development because we use our teeth in forming specific sounds. So if they lose their teeth at the young age during their language acquisition phase, it can affect their speech development in the future. It also is causes an issue with self-image. I've met quite a few children who have dental issues and don't feel comfortable showing their teeth at school. They're very embarrassed, ashamed, and it can affect them socially, emotionally, mentally, not just physically. And lastly, in this slide, there's a lot of reasons why baby teeth are important, but lastly for this is they are placeholders for permanent teeth. So they are kind of a guide for the permanent teeth to come in. So if you prematurely lose a baby tooth, then you run the risk of your adult teeth coming in crooked, therefore requiring braces to straighten your teeth out. So what might seem like an expensive issue to fix now could be a far more expensive problem to fix later on in their adolescence. So there are numerous reasons why baby teeth are important. And a lot of people ask about when baby teeth come in and when they start falling out. So these are some charts with some basic information, kind of telling you what the different kinds of teeth are. So as you can see, the front teeth, the incisors are usually the ones that come in first. They tend to come in about 6 months old, but really the thing with timelines for teeth is that everybody's different. So some parents panic if the teeth aren't coming in soon enough. Everybody's different. There's no hard like time when teeth should be in. So like I said, baby teeth usually start coming in about 6 months, but it could be 3 months. It could be 9 months. Parents don't need to worry about it unless they're, a year old and like nothing's happening. Like it might be a good idea to go to the dentist just to check to make sure like, development is going well. But for the most part, they don't have to worry about it. And so it starts 6 months, and then over the next year and a half or so, they start growing in all of their baby teeth, working their way back. Um, Usually, yeah, by about 2 years old, they'll have all of their teeth. For babies, they have 20 teeth. That's how many baby teeth there are. And then once they get about 6 years old or so, give or take, that's when they start losing the teeth. And then they start losing them in almost the same pattern of losing the front teeth and then the back teeth. And at the same time, they'll start growing in their permanent molars, which now they have room for in their jaws as they're growing up. And so they'll get their 6-year-old molars, then their 12-year-old molars, then their wisdom teeth. Um, but usually they lose their teeth around 6 years old till about 11 or 12 is about when most kids are done losing their teeth. But a lot of people have questions about that. And then now we're going on into some of the problems that we face with teeth, and specifically things that us hygienists are looking for when we do screenings in the classroom. One thing is cavities, or as we call them, caries. So if you hear us say caries, it's the same thing as cavities. Um, and the way you get a cavity is you need three things. You need the bacteria that causes cavities, you need some kind of sugar, which includes carbohydrates, and you need a tooth surface. If you have all three of those things, it is easy for you to get a cavity. What happens is the bacteria eats the sugar and then produces acid, and the acid breaks down the tooth. And depending on what stage it's in or where it's at, the cavity can look brown or white or black. And also depending on how deep it is, it could be painful. It might not be painful, but it is still something that needs to be addressed. Oftentimes, if there is pain, it's usually when eating something like sweets. Sometimes kids will say when they eat candy, it hurts. Also, oftentimes when you're drinking, especially something cold, that can be very painful. That's also something to look out for if kids are complaining about drinking something cold and having a tooth hurt. And then I always add this little caveat of a slide because I see a lot of issues in the mouth day to day, but I recognize that you all might not. So some of these photos might be shocking to you, but I think it's very important that you see what a wide range of issues can be seen in mouths, because a cavity can look so many different ways, an abscess can look so many different ways, and it's important to recognize that there's a lot of variability in these issues. So they can easily be overlooked if you're not aware of that. So here are a few examples of cavities. In the upper left corner, these are like light brown cavities that occur in the front teeth. Lower here, it's a black cavity. On this side, we have a lot of large cavities. This is just a large breakdown of the teeth, and I wanted to show you, I've seen all of these kinds of teeth in the Head Start patients that I've seen. And I think it's also very important to say that any one of these could be painful or it might not cause any pain. Um, so you can't always use pain as a metric for needing to get a child seen, because any one of these can lead to an infection. So we want to get them treated regardless of pain or not. So I made a specific slide for this. It's called Early Childhood Caries. This is a very specific thing that we track when we do our Head Start screenings, because it's considered one of the most common childhood diseases. And what it is cavities specifically on the top front 6 teeth. And we track that because those are the first teeth that usually come in. They're very susceptible to cavities because when babies drink milk, they tend to push the tongue against their teeth, and it leaves residue of the milk on the teeth, and it can just be fodder for cavities. So you can very rapidly get lots of cavities in that area. It could be because um, the babies are left with a bottle in the crib. They drink it, they go right to sleep without having their teeth cleaned. Or it could be, frequent carbs or sugary foods or drinks. It could be that they just didn't start getting their teeth brushed until later in life, or could be transferring that bacteria that causes cavities to the child. So something to be aware of is when parents or other adults share like utensils, drinks with their children. Or another thing I see is a lot of parents will clean the pacifiers with their mouth if it falls on the floor and then gives it to their child. And that simple act can transfer bacteria, which can lead to a rapid onset of cavities. And so what happens if you don't take care of a cavity is over time it gets bigger and deeper into the tooth. And the middle of the tooth is the living part of the tooth. So it has blood vessels, it has nerve endings, it has all kinds of stuff in it. And if it gets into the bloodstream right there, it can go down to the root of the tooth into the body and cause an abscess. And that's another thing that we look out for. And I have pictures of abscesses as well. So, I believe they'll be right after this slide. So, an abscess is an infection from a cavity. A lot of times, because it's this big ball of infection, it is a bump. It shows up as a bump on the gums. Yeah, a lot of times it can look like a pimple, but it could be white, could be yellow, could be reddish because there's a mixture of blood and pus in there. In extreme cases, it can cause facial swelling as well. So that's also something to look out for. These usually are painful until they burst. Once they burst, it relieves the pressure, and so the pain might go away, but that doesn't mean that it's done and you don't need to take care of it. This is something that needs urgent medical attention. As it can lead to an infection that spreads upwards, down, it can spread, into areas that we don't want an infection to spread and can lead to even things like death. So we want to take care of it ASAP. So here is a variety of photos of abscesses. So as you can see, some are kind of yellowish, some are kind of whitish, some are, here, I'm in the way. So a little bit of white, very red. And as you can see, that's something I look for in children is if there's an asymmetry in their face, that can tell me that there might be an abscess going on and that needs to have urgent medical attention. So what do we do about these things? We work to prevent them from even happening, or if they do occur, we have lots of treatment options. So I'm going to kind of dive into a couple of those. So first, for prevention, one thing that we do at All Smiles is we provide fluoride in the form of a varnish that we paint onto the teeth. So fluoride is really important. It's a natural mineral, and it can occur naturally in water. Um, doesn't occur in most of Oregon's water, though, but it is something that the CDC has recommended and has been proven time and time again that that can be used to control and prevent dental cavities. So basically, it just strengthens the tooth and helps protect it against the acid from the cavities. So the reason we come into the classroom and provide fluoride so often is because only about 22% of Oregon's community water is fluoridated. And Portland, Oregon itself is the largest US city without community fluoridation. It's been on the ballot many, many times, but it always gets shot down. People do not want it. So we try to provide fluoride in other ways. It can be through tablets or drops as a prescription from a PCP. It could be from fluoride varnish, which you can get at the dentist or the doctor, or from me when I go to the classroom. There's fluoride gels. There's a lot of fluoride in toothpaste, but there's a lot more fluoride in varnish. So we want to give fluoride in as many ways as we can. And ideally, for varnish, we want kids to receive that about 4 times a year. So we come into the classroom about 3 or 4 times a year when we can. Um, and it's just, a little note that we want at least 6 weeks in between applications. So if, say, that one of the kids has been to the dentist and had fluoride recently, we be in communication with us, and then we'll know that we maybe need to skip it this time and just provide it again next time. Um, But yeah, and then another thing that we provide at All Smiles are sealants. That's just another form of protection, specifically in the permanent molars in the back because they have so many grooves. It's very easy to get food stuck in there, bacteria stuck in there, and then cavities can form very easily. Um, but so we put sealants, which is just a material on top of the tooth, and it can prevent about 80% of cavities in the molars. And for All Smiles, we go into elementary and middle schools to seal those permanent molars as they come in at about 6 years old and about 12 years old. One fantastic treatment that we've been seeing more and more is something called silver diamine fluoride, or SDF for short. What it is a medication, like a liquid, that we can apply onto the cavities. And it doesn't completely treat the area, but what it does is it kills the bacteria and it stops the cavities from worsening and developing further. So it's a great interim treatment until you can either get a filling or the baby tooth falls out or you put a crown on it. But it's great at stopping the cavities from getting worse and leading to an infection. Um, and it kind of helps strengthen the area. It can help with their sensitivity. The biggest caveat, though, that makes the parents very reticent to do this is that it permanently stains the cavity black, not the tooth, just the part that has a cavity. And a lot of parents are um, uncertain about doing this because they don't want the cavities to be that obvious, especially in the front teeth. They're worried about, their kids getting bullied, worried about other people judging them for their kids having black teeth. Um, and part of what I like to do is just to inform everybody about SDF to help kind of reduce that stigma. I'm hoping if more people know about it, then they'll be less likely to judge people, less likely to bully kids for it, because this is a very fantastic thing to do because it's great for if, say, the child is so young and can't handle like more significant treatment. This is a great option to do in the meantime. Or if you know the tooth's going to fall out, is a great option if, you don't want to go through significant treatment, if you can just do this. But the other treatments that you can do are fillings. That's for, larger cavities or cavities on the smaller side, that need more than just the SDF. So they can be tooth colored, they can be silver. Basically, you just drill out the cavity and then you put in a material, to kind of like smooth it back out. For more significant treatments for larger cavities, kids can have stainless steel crowns, which is just like a basic shape of a tooth. Pop it on the tooth, and then it'll eventually fall out. And in very extreme cases, you'll have extractions where they have to pull the tooth. Another question we get often from parents revolves around sedation, because with those significant treatments, typically they need to sedate the child to some kind of degree. Now, there's different levels of sedation. It could be anything from local, like a shot, or mild sedation, like laughing gas is seen in the photo here, or maybe taking an oral medication before the treatment occurs. And the most significant is the deep sedation or general anesthesia, which is like an IV drip, usually done in a hospital setting. Um, Now, it's just important to note that sedation, I mean, there's many reasons why we need it. One, to not feel any pain. Another, to reduce anxiety for the treatment and to reduce trauma. So it's important to like reiterate those factors to the parents who might be nervous at the thought of sedation, but there's reasons for it. So, and the type of sedation too. Like if they need very significant sedation, it a lot of times depends on the patient's behavior and just how much treatment is needed. If they need multiple crowns and they're going to be in the chair for hours, it might be best to use general anesthesia so the child doesn't have to sit through that and it will reduce the trauma the child has. So these are just things to think about for the parents for when they have to decide if they're going to do, treatment with sedation or not. Next on our docket is our pre-K process. So this is what All Smiles does for um, the Head Start screenings. So I just need a drink of water. Okay, so for our process, the first thing we do, we confirm our time and location with the site contact, who's going to be working with us that day. We'll go over consent forms. Sometimes we'll go over all the consent forms before we start, or we might go over consent forms as we see each child. Then we also set up our clinical area, which is usually our rolling cart, and we set up our gloves, mirrors, fluoride, flashlight, hand sanitizer, all that fun stuff. Um, when we do see the students, we confirm the student identity and we confirm what services they're getting. Then we do our screening and then the site contact charts. We provide fluoride if that's what they consented for. We fill out the results forms and we do any referrals at the end, if we need to do them, which I'll get into a little bit later. So our consent forms, we have these on our website if you ever need to print any more out. Our default form is two-sided, side in Spanish, the other in English. But we also have forms available in other languages such as Arabic or Russian, Somali. All of these are available on our website if you need to print them out prior to doing the screenings, if you know a family needs a certain language. But you can also contact us for extra forms as well. But our website's also there. So, yes, a lot of times we'll go into the classrooms, or sometimes we're in an office where we see the students. And for a basic screening, we just use a flashlight and a mirror and we look in the mouth. We're looking for cavities, for abscesses, for any abnormalities to, to make note of. And then we provide fluoride. At the end of the day, the kid will go home with a results form indicating if we saw any signs of cavities or abscesses. They'll get a toothbrush, a toothpaste, and a sticker. And so for charting, a lot of times our site contact will chart for us to kind of help things get streamlined. So we just need to get the name of the patient, their date of birth, the site that it's at, the date of the assessment, and then mark whether we did fluoride or not. If the parent or guardian did not consent for it, we write declined. If the patient wouldn't let us provide fluoride for them, we put fluoride was refused. And then we answer these questions in the middle of the form for the treatment urgency. That's our BSS indicator questions, or the BSS number would be 0, 1, or 2, and I'll get into that in just a second. But we also answer these questions. We answer whether the child has cavities, whether there's treatment present, and whether the child has early childhood caries. And then any comments like the teeth that we see that have cavities or any abnormalities we want to make note of. So the BSS stands for Basic Screening Survey, and that's what the states use to assess oral health status in children or in their patients. A 0 means there are no issues that we've seen. Everything looks good. A 1 means that we see possible cavities, because as hygienists, we can't diagnose cavities, but we can say that we see possible cavities. And a 1 indicates that eventually the child will need treatment because there's quite possibly cavities. A 2 on the form means that there is either an abscess present or the patient reports pain and therefore needs immediate treatment. And then on our end, we also have a 1+ that we can chart. And that basically refers to either large or numerous cavities where there's not pain or abscess yet, but is going to need treatment very soon, or else that will happen. Or if there's like some basic pain of like drinking water or eating sweets, something that like we want to address, but isn't an urgent emergency situation. So if we have a BSS 1+ or 2, then we automatically refer to our care coordinator. We also have ad hoc referrals, and I'll explain how to do that in a second. But when we have a referral, I, as a hygienist, will send information to our care coordinator by end of day. And then within a couple of weeks, the care coordinators will follow up on scheduling, because what they will do as soon as they get the information, they will try to get in contact with the families and to let them know that their child needs dental care. And then they will also work with the DCO, the dental care organizations that are assigned to the families, and we'll work with them to get an appointment set if the patient's family needs help with that. And then, within a couple of weeks, the care coordinator will follow up with the DCO, with the family to try to see if things were scheduled, if things are going well. And if in the case that the care coordinator can't reach the parent or guardian, they have a couple of things that they do. They send a letter to the family, and then the DCO also sends a letter. If there is not an address on file, the care coordinator tries to reach out to the school to find an up-to-date address. We try to find any way to contact the family to ensure that the child get their needs met. So our other referral type is an ad hoc referral. It can be done by family. It could be done by me, the dental hygienist. It could be done by staff. These are referrals that don't fall into the BSS 1 plus or 2 categories. In the case of a family contacting the care coordinator, it's usually a family who's just seeking help finding a dental home, whether they have OHP, private insurance, or no insurance. And so our care coordinators will help get them to a dental home or get them to an insurance, and that they can help them through a lot of steps to get what they need. If, say, I'm referring through an ad hoc referral, it's typically because there's some other oral issue going on that might warrant a dental visit, like maybe a growth or something that just doesn't look right that may need to be checked out by a doctor, maybe biopsied, not sure. Or it could be, say, the patient has been absent the last 3 times I've been there. So we don't really know what's going on. They might not have a dental home, and I haven't been able to assess them myself. So I might send in a referral to our care coordinator to reach out and just check in on the family and make sure that they have a dental home or answer any questions they might have. If the school staff wants to put in an ad hoc referral, they can, anybody can, just as long as we have permission to contact the families. So if you go to our website, you go to our resources, to our forms, you can find the referral for follow-up dental care form. So if you print it out and give it to the family, the parents to fill out, sign it, and then you can send it to us, and that gives our care coordinator permission to contact the family directly and get them whatever they need. So for family advocates, because we work together with you all for these screenings, there are a few ways that we can hopefully help each other out. One would be a lot of questions we get from families is just about the OHP card itself. So any way you can help, like walking families through the OHP card to explain that card information, what numbers to call, because a lot of families don't realize that their dental home is on their card. Another thing is to remind families that if they move or change their address, that they need to update OHP so they can stay on the plan. They can stay up to date with information. And after we help secure a dental home or get care for specific dental needs, please continue to follow up with patients to ensure that they still are seeing their dental home and that routine care is established. Because a lot of times we'll see kids who have a problem, get that fixed, and then not really go back to the dentist. And then another problem comes up. So we want to see these kids regularly going to the dentist and focusing more on preventive care than having to do more treatment and reactive care. And then when updating like Child Plus about dental referrals, please include as many details whenever possible. So we know if they missed an appointment, why did they miss the appointment? Did they just no show or was somebody sick? That kind of helps us tell us what we need to do next. Do we need to do another referral or is this something that's still in progress? So any details help us out with our next step. Okay, next up is home care. So this is the basic preventive care information that you can give to the families to work with their kids at home. So kind of talking about toothbrushing, flossing, toothpaste, some dietary stuff, and just like basic prevention. So ways that we can prevent dental decay is through diet counseling, kind of letting people know like how cavities are formed through a lot of sugar and carbohydrates. Talking to them about feeding behaviors, like I was saying earlier, like, not letting kids go to sleep with a bottle, making sure they brush their teeth after they drink, their milk and before they go to bed. And just like using preventive things like fluoride and maintaining good oral hygiene. For babies, even before they have teeth, you can start cleaning them out. So we recommend wiping their gums twice a day with like a soft, clean cloth. Good times are right after their first feeding and right before bed to kind of get them in that routine because before you know it, the teeth are going to start popping in. And once they start coming in, start brushing them twice a day. You can use like a little like finger brush or even just like a rag, just something that will wipe off the teeth. And a good rule of thumb is to make the baby's first dental appointment either by 6 months old or when their tooth comes in, first tooth comes in. So whichever happens first. I know it's hard these days because there's just so much demand for dental providers, but not enough dental providers. So there is sometimes some push and pull with that from dental offices. So we're still kind of figuring that out, but just definitely like let people know, like, please advocate for yourself and for your kid to be seen. We want the kids to be used to the dentist before any issues arise, or hopefully no issues will arise because they're having routine dental care. And then a big rule, just don't let the baby fall asleep at the bottle. That's where you get early childhood caries a lot of times. And then as the kids grow up and get more teeth, continue to brush twice a day with fluoride toothpaste. And it's really important that you help your kid brush their teeth until they can do it themselves, which is maybe around 6 years old. That's about when their fine motor skills start kind of getting there. But continue to monitor the child until, you're sure that they have good brushing habits. A lot of times it is nice to brush with the kid. Brush your teeth as they brush theirs. And also incorporate flossing before bed as well. And again, make sure your child doesn't eat or drink anything between brushing and bedtime, besides water. Water's okay. So, as far as compliance goes, um, it's important to kind of talk about what products you're using because that can affect the child's compliance in brushing their teeth. There are a lot of different types of toothbrushes, and it's a big part is finding the right size for your kid. There are infant toothbrushes, there's child-sized toothbrushes, and there's ones with big handles that are easier for kids to hold. And they have different kinds of bristles. You can have extra soft or soft. You can never have too soft of bristles. There's manual versus electric toothbrushes. So it's really about finding what works for your child. Oop. And then toothpaste is a big part of compliance. A lot of kids don't like brushing their teeth because of the toothpaste. They use minty toothpaste, it's kind of spicy. So we recommend like berry flavored or some kind of fruity flavor of toothpaste for the kids. They tend to like that more. Another factor that could be affecting them is just the amount of toothpaste. If there's too much toothpaste, it could be overwhelming and just is not necessary. So we recommend for babies who can have fluoride toothpaste as long as you do it very moderately. You want about the size of a grain of rice, as seen in this photo. And then as they get older, you can have the size of a pea. And more than that can be overwhelming and could cause a tummy ache from too much fluoride. And then floss. There's lots of kinds of floss. There's waxed versus unwaxed. There's flavors of floss. There's floss picks. There's water flossers and water picks. So again, it's kind of about just knowing that there's so many things out there and trying to find which one works the best for your child. We've created this like kind of handy dandy little sheet that I've kind of parsed up here with like little tricks for if the kids are not compliant with brushing. And I mentioned some of them already, the amount of toothpaste, the flavors of toothpaste, being a role model for your kid, brushing with them. Another thing is to keep a routine. And I always tell kids that I see who don't brush their teeth, it's like, well, do you change into pajamas? Do you go to the bathroom before you go to bed? Add brushing your teeth right in there. You already have a routine, just add to it. Or could you could have a reward system. We have little calendars we give out sometimes that you can use stickers or check mark that you brushed your teeth that day. Another really big one is finding a song on YouTube to go with brushing your teeth. A lot of Head Start programs do this, you know. So having the parents do it at home might be a nice little like addition to their routine. And basically, any character, so many characters already have their own brushing video. So you can probably find something that your kid loves. Okay, last part. We are almost done. These are the resources, and this is built up from frequently asked questions we've gotten from from the care coordinator, from hygienists, like people in the field asking us these kind of questions. So first off is how to find a dentist. And you can always direct families to our website under resources. We have a very robust page of finding dental providers. There's a lot of dental insurance information on there. There's also information for people who don't have insurance. Um, and then you can find lots of information just on the OHP card itself. There's this part on the back where you can call for the dental health plan, um, and they'll tell you what your DCO is. And you can call for questions about, getting a list of dental clinics that accept their insurance. They might have information if you have Care Oregon, it might be a different place that you call. But it's all on the back of the card. But I also have resources on here as well for Oregon Health Plan. I have their phone number, their website. You can always direct families to call to confirm their membership, to know what DCO they have, to change their DCO if there's a specific type that they want, or even get a replacement card, which I spelled wrong on here. Okay. Um, and this is stuff that I'm kind of learning too. Insurance is not my forte. It's very complicated. But from what I understand, OHP has two plans, Trillium or Health Share. And so I have contact information for both of those if you need them to provide to the families. And then underneath those are dental care organizations such as Advantage, Care Oregon, Kaiser, Willamette. These are all people who just different kinds of DCOs, and you can always contact them to find out what clinics accept your insurance. You can always call the DCO, or you can go to their website and use their directory or search tool to find nearby clinics that will accept your insurance. Now, if patients don't have insurance or need help directing them to something for insurance, answering questions, we have partners that are federally qualified health centers. These are Virginia Garcia Neighborhood Health Center, Multnomah County, and Clackamas County. These all have people trained to be able to look up patients' dental plans and also help direct them. They can also help you enroll in OHP. These are just more resources. This is kind of what our care coordinator does, but these are just more options that people can use if they'd like. Another thing that I'm not super familiar with, but I've heard a little bit about is Project Access Now. It's a community assistance program, and they can help you or help people enroll in OHP or marketplace insurance. And there's just community health workers there who can help with a variety of other things as well. So it might be something worth kind of checking out or just adding to your little resources. And then another question we get from families is dental care for the adults. And so one thing that we provide is information about Medical Teams International, and it's a dental clinic van, a mobile dental clinic that serves specifically adults and provides free restorative services for people with variety of insurance or no insurance. They serve like vulnerable populations who need urgent dental procedures done, like extractions or fillings. Basically, they're there for people who are in pain and don't have regular access to dental care. Sometimes people can't get their dental needs met because they can't get to the appointment. So this is kind of information from HealthShare and from Trillium through OHP um, for ways to get transportation to their appointments. It could be anything from reimbursement for gas. It could be bus tickets. It could be a vehicle that they provide for you to get to your appointments. And these are the contact informations for the different health plans. So we are now getting to the end of our presentation. So after watching this, we've learned a lot about teeth. We've learned kind of what to look for in terms of cavities and abscesses. We've gotten a lot of oral health education. We've seen how All Smiles does their Head Start screenings from start to finish, and we've seen a plethora of dental resources. And I have this last bit of slides. Um, if you have any questions, I have my email address on here. You can contact me directly. If you have care coordination questions or referral questions, we have our care coordination email. I have our website provided as well as our office phone number if you need to talk to anybody. And I also have all of my sources right here if for whatever reason you would like to see more information. And I hope that you enjoyed this presentation as long as it was. But hopefully it provided lots of good information for you, for yourself, and for the families that you serve. So thank you very much.